Hello viewers, myself Dr. Vishal Chafale. I am consultant and intervention neurologist practicing in Apollo Hospitals, Navi, Mumbai. Today I will give brief information on autism. Autism is a common problem. It is a developmental disability which impair how we communicate with the world. There are issues and deficits in the social communication and non-verbal interactions, like there are poor eye contact, facial expression, body gestures. Along with that, these children also have issues in the language development. Sometimes speech is not developed at all. Sometimes it is very poor, and sometimes it is developed, but they don't understand the context or the sarcasm or the tone of the speech. Sometimes there is an echolalia, or they keep repeating whatever we say. So this is very common in autism. Along with that, there are some abnormal repetitive movements of the body. We call it body rocking, hand clapping. We also call it stereotyping. Children do it to relieve their anxiety stress, and sometimes they enjoy it, that's why they keep doing it. In such children, there are sensory issues, there are sensory phenomena. With normal surrounding also, sometimes they get irritated. So it can be a particular for a particular child. There can be associated problems like there can be hyperactivity, there can be sleep disturbance, sometimes there can be associated mental retardation, there can be reduced attention span, they have sleep disturbances, they have sometimes injurious behavior also. So these are the various associated issues with autism, and when these issues are more common, and along with the autistic picture, we also call it autistic spectrum disorder. So this starts in the early phase of life. Most of the time, within 3 years of the life, it is detected, and shows a slight more predominance in the male. So almost 3 to 4 times more common in male than female. It's a multifactorial. There are multiple genetics and environmental factors. They come together into play, and they affect the brain development in early part of the life. It affects it forms the faulty neural networks which maintains or which process our socio emotional information. So ultimately giving rise to autistic features. So we should suspect autism, or we should think of autism uh, in early in the life if there is a no development of the speech or no gesture development by 12 months, or there is no single word development by 16 months, or there is no two phrase formation, two words phrase formation by 2 years of the life, or at any moment is there any deterioration in the achieved language or social milestone, we should think of autism or suspect autism, and we should consult your pediatrician or your neurologist so that early intervention can be done. Then treatment lies early detection and early intervention very important so that we can modify the behavior and we can improve the symptoms of the autism. Educational and behavior therapy is an important part of the treatment. We should involve parents more. Parental involvement is very important because ultimately the parents would give primary treatment or primary care to the child. So it will improve the parental bonding, and also parents know the issues, and they know the need of their child, and they can provide, and they can help them in better way. So education intervention are very important. They should be started as early as possible. It is recommended that at least 25 hours a week educational session should be given to autistic children to improve their symptoms. Sometimes some simple tricks will help, so we should learn. The treatment should be individualized, and every children is different. Every autistic children have different sensory issues, and we can tackle them in different ways. So by doing this simple modification in their environment, we can help them in better way. Rarely, if symptoms are out of proportion and they are disturbing, then only we do pharmacotherapy. A lot of medicines are available, but generally we prefer non-pharmacological measures. Actually, that is the primary line of treatment. So, autism is not treatable, and it should be diagnosed early, and we can improve the quality of life of such patient by giving early educational and behavioral therapies. and by we can make the life of such children better by providing them better environment according to their needs. Thank you.